Hello, Methodist Hospital. Our group is here to present to you a Level 3 emergency room design that we believe would best suit the Elk Grove community's needs. Please follow along with this tour of our model ER. When you first walk into our ER, you will be greeted by our front desk staff to check you in and inform you when your vitals can be taken in the triage room to the left. We are staffed with a wide variety of specialties available to serve a diverse population. To address any staffing shortages, we teach our employees through an uptraining program where each employee is trained in multiple relevant specialties. Our staff at the front desk, for example, does clerical work, IT work, troubleshoots technology and software problems, organizes patient information, and directs them to relevant areas of the hospital. They also function as nurses, being able to take vitals and triage patients if needed.
Elk Grove is home to around 180,000 residents, about 80% of the population being younger than 60 years old. Most households in Elk Grove have an average size of 3.19 people, and there are many families residing in the surrounding neighborhoods of the emergency room's anticipated location. Consumnes Oaks High School and Ridge Apartments are also right next to the area where the ER is planned to be built, so we took into consideration the specific age groups in this region, which may include young individuals. Children can often become bored and restless while waiting in these facilities. So we created a playroom with a variety of activities with an antimicrobial coating to keep them occupied and safe. Our activities are easily stored and don't make a mess, such as coloring books and crayons, board games, and word searches. Free Wi-Fi is also available throughout the ER, including the waiting room, to put patients at ease so they may complete any work they missed while in the ER or for any other personal needs.
As we mentioned before, Elk Grove has a diverse population, with the two major ethnic groups being white and Asian. Although 65% of the population only speak English, 17% speak an Asian or Pacific Islander language, 9% speak Spanish, and the other 10% speak some other language. It is important for us to take into consideration the needs of different groups and help them feel as comfortable as possible during their stay. We have translators available whenever necessary so you can effectively communicate your concerns and symptoms to us. In addition to the triage area, there is a fast track section to the left of the front desk. Here, patients with minor injuries that can be treated quickly are tended to. Once a patient from the walk-in entrance is triaged, they are seen in the fast track section if they have a non-urgent complaint, such as a rash or a cough. A physician assistant or nurse will see them, then send the patient home. Our triage and fast track section is designed to improve patient flow and ease the burden on our staff by reducing the number of patients waiting to be seen.
In the center of our ER, we have an interconnected physician-nurse workspace. Here, our professionals can easily communicate with one another and have a clear access to all the rooms in the ER. In this area, physicians and nurses can either enter in information on other patients as well as monitor the patients that are in the waiting area. The workspace is in the middle of the ER, so patient records can be easily accessible when our staff is going from room to visit the patients around the ER. Glass screens are set up around the workspace so physicians and nurses can observe patients in the hallway all around the ER, and they can also direct patients to different sections of the ER if needed, as well as answer any quick questions that the patients might have, while also being able to do their work. Surrounding the workspace are very wide halls that connect in a circle. This allows for efficient flow of motion and transport of patients, as people are easily able to get from one end of the hospital to the other through just one hallway. Additionally, in the back of the workspace is a staff lounge, which provides as a break area for our hard-working staff. So this is where the staff can relax and then they can take a break, especially if they're stressed.
In order to keep our hospital safe and maintain in a chaotic situation, we have a dedicated security room to the left side of our hospital. Our security room houses our security cameras with 2 security personnel watching the cameras to make sure all is in order. We also have security personnel stationed all throughout the emergency room, equipped to respond to any situation. The security room is stationed near the playroom and waiting area, in particular to monitor patients while they are not being directly attended to by a specialist. Above the security room is a family, gender-neutral bathroom to ensure inclusivity and so that families with small children have a space to take care of their kids' business. Efficient communication between departments and staff is a priority. All of our workers are equipped with 2-way pagers to communicate with one another. Pagers are small, portable, require no cell service, and are secure since they cannot be hacked, although they are able to receive phone messages as well. They are our reliable method of communication if cell service at the hospital is cut off or in case of emergency. This can help our staff effectively communicate without having to directly find each other, especially if they may be busy with other tasks.
In consideration for our patients with more emergent conditions that require our immediate attention, we have designated the northeastern section of our ER for checking in and treating these patients. An ambulance bay entrance is right by our trauma bay, allowing better patient flow and preventing congestion. Our trauma bays are kept fully stocked at all times, and the supply room connects our trauma bay and private rooms to ensure patients receive all treatment as efficiently as possible. Next to the trauma bay is another triage room for patients arriving by ambulance. There, patients with more severe injuries can be properly assessed and treated.
To the left of our trauma bays, we have our bathrooms, diagnostic suites with our X-ray, CT, MRI, and ultrasound equipment on hand, and our major operating room for quick access for emergent patients due to the close proximity to the triage room, ambulance bay, and trauma bay. Our operating staff room is staffed with multiple nurses and surgeons to conduct surgeries with the utmost quality and as fast as possible. Also, we have all the supplies found in any other OR room, such as monitoring devices, IV bags, laceration supplies, defibrillators, and chest compressors. After their surgery, patients will be wheeled off to the private rooms for recovery.
Our private rooms allow for patients to recover after treatment they receive in the ER until they're stable enough to be transferred to a hospital or private consultations. Our private rooms are supplied with ventilators, feeding tubes, dialysis equipment, and also other equipment that are used to stabilize patients. And we also supply each private room with monitoring equipment, which will signal to nurses if vitals suddenly drop or spike so they can reach the patients in a timely manner. There's also a button call that's in each room, and it's usually installed near the bed, and this is where patients can easily click it to call for assistance. This gives our patients reassurance that help is on the way, and we stress the importance of making sure our patients feel comfortable and have easy access to ask for help whenever they need.
Visiting the ER is no walk in the park. Many patients enter these facilities with pre-existing anxieties and concerns on what their experience will be like, what's going on outside the hospital, and concerns about the health of themselves or their loved ones. Combined with the increased incidence of mental health patients, our team recognizes this is a prominent issue. To combat this, we offer animal therapy services for those struggling to adjust to the ER environment. Poodles are friendly, intelligent, hypoallergenic pooches available to all patients when needed in our de-escalation services room. Overseen by therapists, patients have the option to learn basic tricks to play with the poodles in order to ease their mental state, or may simply pet or hold the poodles for comfort. Our poodles are obediently trained to respond to emotional signals and will only engage with patients if desired. Located in the northwestern corner of this facility, this room is designed to be as far away from the noise and commotion as possible. Research shows that the wall's brown color helps calm down patients who are panicking by creating a comforting, home-like feel. It can be hard to stay calm when there's so much going around in the ER, so we want to provide patients a quiet space to collect themselves before resuming treatment. Attached to de-escalation services is a psych ward, where patients struggling with their mental health have a private, isolated room where they may receive treatment in a controlled environment.
Ultimately, our priority is to make our patients' experience in the ER as smooth as possible. Our emergency room department design optimizes efficiency with our professionals upskilled and centered in orientation, clearly marked rooms, a fast-track system, and clear walkways, as well as patient comfort with our playrooms, de-escalation services, and therapy animals. Thank you for your time and consideration.